Okay, hello. Today we're going to do a head-to-toe assessment. And the equipment that you're going to need is your stethoscope. And make sure you clean your stethoscope between patients. Always, always. You need your pen light. You're going to need a basin with some gloves and and some towels just in case you need to clean your patient. Okay. I always keep my PDQ because your PDQ is very good for reference. Sometimes you might forget what to assess or what to document. This is like the Bible. You need your pen light. I don't know if I said that already. Okay. And then, of course, you would need your vital signs equipment. So you would do your vital signs prior to starting your head-to-toe assessment. I got to bring this down because my glasses is fogging up. Okay, so the first thing you want to do before you go into the patient's room is knock on the door, right? So you don't want to just barge in there. That's rude.com. So you want to knock on the door. And he's like, hello. Come on in. Somebody can pay the patient, but that's okay. Come on in, right? So then you want to come in, introduce yourself, and you would say, hi, my name is Kathy. I'm a student with J. Renee College. I will be your student nurse today, and today I want to do a head-to-toe assessment. Is that okay with you? And the patient's like, what is a head-to-toe assessment? So then you have to explain what you're doing with the patient. So a head-to-toe assessment is basically, I'm going to assess your entire body. I'm going to listen to your lungs, listen to your heart, listen to your stomach, look at your skin, look for anything that, any break in the skin or anything of that nature. Is that okay with you? Patient says yes. So then you're going to proceed to make sure you identify the patient. Sometimes I identify the patient before I go through that whole spiel of what I'm going to do. Why? Because if you don't identify the patient and you start that, and then when you identify the patient, it's the wrong patient, that's a waste of time, right? So first thing to do to identify the patient is you want to look at the patient's wristband. You see this patient doesn't have an arm over here, so therefore I can't look at a wristband on this arm. So I have to look on this side. And as I'm looking at the patient's wristband, I want the patient to state his first and last name. So the patient would say, my name is Alvin House. Can you tell me your date of birth? October 14, 1921. Okay, Mr. House, all righty. And then also you want to ask, do you have any allergies to medications or anything environmental? No allergies that I know of, okay? So I have the correct patient, right? So I can go ahead and proceed with my head-to-toe assessment. So the first part we're going to do is the head. We're going to start with the head, then we're going to go to the chest and the arms, and then we're going to go to the lower legs and the genital area. And then the last part, we're going to flip them over to the side, not flip them, turn them over to the side and look at the posterior part, okay? So, Mr. House, the first thing I'm going to do is I'm going to touch your hair. Is that okay with you? You always ask the patient permission whenever you're going to touch the patient. Now, it is your preference to put gloves on this time or not. Okay, if the hair is visibly dirty and there's stuff crawling in there, of course, we're going to put some gloves on. But if not, I choose, because my patient's hair is very clean, we just gave him a shower, so he's fine. I'm going to go ahead and touch his head without my gloves on. That's my business. You do what you do, okay? So, first thing you're going to do is just touch, and you ask Mr. House, does this hurt? Are you having any pain? No. So what are we feeling for? We're feeling the texture. We want to see if it's coarse or is it thin? Are there any bumps? Are there any bruises? Okay, always lift that head up. Mr. House, I'm going to lift your head up because you want to look behind that neck area. But we'll see it better when we turn them over as well, too. Okay, that looks good. Next thing we're going to go to is the eyes, right? So when we're doing the eyes, we're going to assess PERLA. Okay, that's P as in Paul, E as in Edward, R as in Romeo, R as in Romeo, L as in love, A as in apple, right? And when we're doing the eye assessment, the PERLA assessment, we're looking for neurological deficits, right? So first thing we're going to do is look at the pupils. The pupils are the little black dots in your eyes. So we want to look at the pupils. The E means equal. So we want to make sure that the pupils are equal in size. If they're not, that can indicate that there has been some type of neurological deficit. Okay? And then the next thing we want to see if the pupils are round in size. So the pupils are both round. And the next one is reactive. The next R is reactive. Reactive to the L, which is light. So we take our pen light. So you want to get a pen light. It doesn't have to be an expensive one, but I would recommend getting one with a battery so you can just change the battery out. But you want to get one that has a pupil gauge on it, okay? But if yours don't have a pupil gauge on it, guess where it's at? It's in your PDQ, okay? So, and this is washable. You can bleach it down, take it in and out the patient's rooms. They're really nice. So first thing we're going to do is look at the pupil gauge, and we're going to see what size our patient's pupil is before we shine the light in the eye. So if we look, the right pupil is 3. This pupil on the left is about a 6. So clearly those are not equal, right? Clearly something happened with our patient neurologically, all right? So now we're going to shine the light into the patient's eye. Now, when you do this, you want to tell the patient to look at your nose, not at the light. Look at my nose, not at the light, okay? So when I shine the light in the patient's eye, what is the pupils going to do? Constrict. Very good, right? So when they constrict, do they get bigger or smaller? Smaller. Very good. So if you can come up with that answer, I'm going to tell you a way to remember that. You know how you get all fresh and cute for the summer and the sun is out and you go outside and the sun is really bright. What do?
Squint.
You squint. You do like this, right? Your eyes get smaller, right? So when you put the light in, you constrict, okay? Your eyes get smaller. At nighttime, you get up because you got to go to the bathroom really, really quick and it's dark, right? You get up, and I know you guys do this. When you get up, you do like this. You have your eyes real big like this, right? For no apparent reason. The reason why you're doing that is because dilation, when you dilate your pupil, it allows more light in, okay? So constriction, smaller, dilation, you're looking buck-eyed in the middle of the night, okay? So remember that. Okay, Mr. House, I'm going to shine a light in your eye, but don't look at the light, look at my nose. Huh? What do you mean? Okay, I'll say it again, Mr. House. I'm going to turn you towards me here. I'm going to shine a light in your eye, but I need you to look at my nose, not at the light. Okay, I got it. All right, so you always want to test your equipment. Make sure your light is working. It's not flashing and causing the patient a seizure. So it's working. And you always want to turn the light on out and bring it in, okay? Turn it on out and bring it in. So Mr. House, look at my nose. Very good. Good job. One more. Look at my nose. Good job. And when I put the light into his pupil, it goes down. Then I look at my little handy dandy pupil gauge. So he was a 6, it went to a 4. Okay, and how we document that, we document it as a fraction. 6/4. Every nurse in the healthcare field know that that top number 6 is what his pupil size was before we shined the light. Every nurse in the healthcare field knows the 4 underneath the fraction is what happened when the eyes constricted with the light. Okay? All right, Mr. House, let's do it one more time. He's stupid. I don't know, they didn't get it. Look at my nose. Good job. Look at my nose. Good job, Mr. House. One more time. Look at my nose. Good job. Keep looking at my nose. Perfect. Okay? So that is pupils equal, reactive, round to light. Round, reactive to light. Last thing is accommodation. So accommodation is when we want to see if the eyes accommodate to an object. So if you're looking at me and I say, look at this pen light, but with your eyes only, don't move your head. When I bring it in, you see how my eyes focus in on there? They kind of go cross-eyed. And then when I focus out, it adapts accommodates to the object, okay? So what we tell Mr. House is, Mr. House, one more last thing. I need for you to look at my pen with your eyes only. Do not move your head. Okay, good job. In and out. Just go further enough in. Don't hit them. Just go. Good job. And then I'm going to go check the peripheral vision. Just your eyes. Don't move your head. Good job. Excellent. Okay? So that would be Perla. Pupils equal round, reactive to light accommodation. And that's a lot for the eyes, I know. But we're not done with the eyes. Of course we're not. So then I want to assess for any drainage, any redness in the eye. So I'm going to pull down the conjunctive sac and just look for any redness. It should be nice and moist, not any drainage. If there's drainage, you want to document what that drainage looks like, okay? And then next, we're going to go to the ears, okay? So we're going to look at the ears. So Mr. House, we're going to look at your ears. And remember when I said in class, if you have two of something, we're always supposed to look at it at the same time. We want to compare it, right? All right? So we got two ears, right? So we want to look at both ears, make sure they're symmetrical, right? We want to look at the pinna, pull that up, look inside for any earwax, which is called what? Cerumen. That's what you said. So we're looking for cerumen. And if there is, we want to document how much cerumen. You might say, well, what am I supposed to do? Take it out? Yes. You know, or you document how much in there. You can say, don't say a small amount because small is different for everyone else, but you can say something like a pea size. We all know what a pea looks like, right? We all know what a dime looks like, or a nickel. That would be a lot of cerumen. But use adjectives like that, okay? So then we looked at the ears. Next, we're going to look at the nose. Make sure it's symmetrical. Mr. House, I'm just going to move your face a little bit, all right? Then we can take our pen light, look at the nostrils. For any drainage, make sure the mucous membranes are pink and warm, okay? If there's any drainage, again, we want to document what that drainage looks like, all right? And then next, we can check for the patency of his airway. So what we would do with that is to cover one of the nostrils and have Mr. House breathe in and out. And if you feel good airflow, then that one is patent. Patent just means that whatever we're testing is flowing freely through. Okay, same thing over here, in and out. Very good, Mr. House. Okay, now next and the last thing we're going to look at is the lips in the mouth, right? So the lips, we want to make sure that they're nice and pink and moist. They're not cracked or dry. Okay, that could indicate what? Dryness, dehydration. Ding, ding, ding. Very good. So we're looking at the lips. We have him open his mouth. We take our pen light, looking in there. Any missing teeth? Oh, is these dangerous? Yes, he got upper and lower, so we would take those out so we can actually see the gums. Tell Mr. House to stick out his tongue, and his tongue should be in the middle, midline, okay? If it's leaning, that's not good. If it's leaning this way, that could indicate a what? Stroke. Look at you guys, are so smart. So we want to make sure it's a midline, okay? And how we document that is just saying the tongue is midline. If it's over to the left or to the right, we say that the tongue is deviated to the left or to the right, okay? And then we want to have the patient smile. The smile should be symmetrical. If there's a droop, we want to document. If it's on the right side or the left side, again, that could indicate that the patient possibly had a stroke as well too, okay? And I know that was the last thing I said, but the last thing is the skin. I normally like to do that before, but you want to check the overall appearance of the skin. So we want to make sure that the skin has good perfusion. So what color would the skin be if it has very good perfusion? Pink. Pink. What color is my skin if it has good perfusion? Pink. Pink, right? Even though I'm a chocolate, I'm still pink. You don't document chocolate, you document pink, right? So the skin is nice and pink, and when I touch the skin, it should be what? Warm to the touch, right? Not cool. Cool is like, ooh, what's going on? Cold is dead. like what you said. So the patient not doing too good if it's cool and cold, right? That's poor perfusion. So it's warm to the touch. It's nice and pink. We want to make sure that there's no discomfort, no pain, no numbness or tingling or paralysis with the skin as well too. And we want to make sure that the skin is intact. And what I mean by intact is that the skin, there's no bruises or no redness or anything of that nature. If it is, then we have to measure that. Okay, so that would be the first part that we will assess, and that is all of the head.